osteosarcoma in July of 2007. And she had a limb spare surgery in August of 2007. So the limb spare, they went in and they removed part of her right distal radius. They removed the bone and they replaced it with a metal rod. And then she had 14 screws drilled into the remaining bone to hold the metal rod in place. And there's a high risk of infection with the limb spare, so she was on a lot of antibiotics to prevent the infection. But the studies also show that like 40% of the dogs with limb spares get infections, but the ones that get an infection actually have a longer survival time. But she never got an infection, but the cancer came back in January, and that's when I had to have the leg amputated after all. As far as her lungs go, in June she had one lung met in one lung. In July she had a lung met in the second lung, and the first lung met had doubled in size. So she'd been on the metronomic protocol for a month, and they decided to take her off of it because they said it wasn't working. And then in November, curiosity was killing me, so I took her back for a chest x-ray, and that's when they found out that one of the lung mets had disappeared in one lung, and the other one had decreased in size. That's 7 centimeters to 6 centimeters. So when the one lung met disappeared, and she was just left with another lung met, that meant she was eligible for surgery. So she had one lobe of her lung removed. And they discovered the mass on her liver the size of a tennis ball, and they removed that too. And so far, she's been doing okay.
That was how many months ago?
November, 6 months ago. So I at least got 6 extra months with her. She's really bold. Would you say
it's time to walk away from all the things you say. I've gotta strike out on my own before the sun will rise. I will dry my eyes and I will walk out in this world a strong girl, a strong girl.
Preparation took 2 weeks. Every time, well, no, the amputation took 2 weeks. Actually, it took a little bit longer, maybe like 2.5 weeks. I was starting to get worried because it took her a little bit longer than normal. The thoracotomy and the mass on her liver took 2 weeks to recover. The limb spare, you had to be really careful with them for 3 months after the limb spare. You know, just make sure nothing goes wrong. So the limb spare was the toughest surgery because they had to have limited activity for 3 months. No, I mean, as a pharmacist, the medication she was on basically just made her really drowsy. She's on fentanyl patches, I think, after the limb spare surgery. She's on tramadol after her other surgeries, and it mainly just made her really drowsy and groggy. She probably panted a little bit extra when she was on the high doses of tramadol. I know some drugs, like especially morphine, the dogs will whine or cry out, and that really alarms people, the whining and crying. But she was on morphine for like a couple of doses. She's just a total zombie on morphine, so like that's not going. If she has to stay on morphine, that's not much of quality of life.
It's time to walk away from all the things you say. I've gotta strike out on my own before the sun will rise. I will dry my eyes and I will walk out in this world a strong girl, a strong girl, a strong girl. Something's wrong, I'll be moving on. It's been tough, I had enough, 'cause I'm a strong